I have spent over 30 years in the high-stakes, adrenaline-fueled theater of the emergency room. I have seen the absolute best of the human spirit and the most heartbreaking of its ends. But there is one specific sound that haunts me more than any other. It's not the sirens, and it's not the rhythmic beep of the heart monitors. It's the sound of a family in the waiting room, realizing that their loved one didn't make it simply because they waited 20 minutes too long to act. If you are over the age of 60, I need you to look at me and hear me clearly. Most people in your age bracket will not survive their first heart attack if they are alone. That isn't me trying to scare you. That is a brutal statistical fact born from decades of clinical observation. Nearly 50% of heart attack deaths happen before the patient ever crosses the threshold of my ER. They die in their armchairs. They die on their kitchen floors. They die with their hand inches away from a phone they were too hesitant to pick up. Why does this happen? It's rarely because the heart attack was unsurvivable by nature. It's because of the three horsemen of cardiac fatality: hesitation, denial, and panic. We see it every day. A patient is brought in, and the golden window, that precious first hour where we can actually reverse the damage and save the tissue, has already slammed shut. Their heart muscle has begun to turn into non-functional scar tissue because they spent the first 2 hours of the attack wondering if it was just the spicy chili they had for lunch or a bit of strained muscle from gardening. In the medical world, we have a saying that is carved into every cardiologist's mind: time is muscle. Every tick of the clock is 1,000 heart cells dying, cells that you will never get back. Once they are gone, your life changes forever. Your independence shrinks. Your strength fades. But today, we are changing that narrative. You are not going to be a statistic. There are science-backed, cardiologically proven techniques that can double your odds of survival, even if there isn't a single soul in the house to help you. These aren't hacks, miracle cures, or internet myths. These are the cold, hard protocols I wish I could whisper into the ear of every senior before they ever feel that first terrifying twinge of pain. In this masterclass, I am going to walk you through the 7 life-saving pillars of solitary survival. We are going to go deeper than any 30-second clip or medical pamphlet ever could. We are going to talk about the biology of what's happening in your chest, the exact physical movements that can keep blood flowing to your brain when your heart is failing, and the number 3 secret that paramedics wish everyone knew before the ambulance arrives. This is more than just a video. Consider this a virtual checkup and a survival roadmap. Before we open the first pillar, I want to start a dialogue with you, because a doctor is only as good as the history he takes from his patients. How old are you? And have you or a loved one ever had a scare that turned out to be something else? Tell me in the comments. I personally go through and reply to these because your history matters to the community we're building here. Now, take a deep breath. Let's start with number 7, the psychological hurdle and the physical decision that dictates whether you live to see the sunset or become a memory. The greatest obstacle to surviving a heart attack isn't a blocked artery. It is the human mind. After 30 years in the ER, I can tell you that the most dangerous sentence in the English language is, "I'll just wait and see how I feel in an hour." In seniors, this is often driven by a noble but deadly trait. the desire not to be a burden. I have sat at the bedside of countless men and women who admitted they felt the crushing weight in their chest at 6 p.m., but didn't call for help until 9 p.m. because they didn't want to wake their children, or they didn't want the neighbors to see an ambulance in the driveway. They were more afraid of a false alarm than they were of a fatal one. Tip number 7, call emergency services immediately, no exceptions. The very first and most critical action when you feel the signs of a heart attack is to activate the professional rescue system. You must understand that a heart attack is not a static event. It is a progressive chemical and physical collapse. When an artery is blocked, the heart muscle begins to suffocate. This isn't like a cut on your finger that will clot and heal on its own. It is a house fire. If you wait to see if the fire goes out by itself, the roof will collapse. The American Heart Association has compiled decades of data showing that patients who call emergency services within the first 5 to 10 minutes of symptoms have survival odds up to 50% higher than those who wait. Why? Because the treatment begins the moment the paramedics walk through your door. They bring the ER to your living room. They have the EKG, the oxygen, and the life-saving medications that start working before you even reach the hospital. Let me tell you about a man named Arthur. Arthur was 72, a retired engineer who lived alone in a quiet suburb of Indianapolis. One Tuesday night, while watching the news, he felt a strange, dull ache in his jaw and a tightness in his chest that felt like a heavy coat. Arthur was a tough-it-out kind of man. He thought, "It's just the steak I had for dinner." He drank a glass of water and sat back down. He waited 3 hours. By the time the pain became so unbearable that he finally slumped over and his neighbor heard the TV blaring and checked on him, the damage was irreversible. The doctors told his grieving family that if Arthur had called the moment he felt that heavy coat, he would have likely walked out of the hospital with a stent and 20 more years of life. Instead, his hesitation became his final act. If you are over 60, you must adopt a new rule. Act as if it is a heart attack until a doctor proves it isn't. I would much rather see you in my ER, embarrassed that it was just indigestion, than see your name on a chart in the morgue because you were too polite to call for help. If you feel crushing chest pressure, sudden shortness of breath, unexplained nausea, or that eerie, drenching cold sweat that makes your skin feel like ice, pick up the phone. Do not call your daughter first. Do not call your best friend. Call 911. Recognizing the urgency and making that call is the first act of survival. But while you are waiting for those sirens to get closer, there is a chemical intervention sitting in your medicine cabinet that can buy you the time the paramedics need. Once you've made that call and the dispatcher has your address, the clock is still ticking. You are now in a race against your own biology. Inside your chest, a drama is unfolding that requires immediate chemical intervention. This brings us to tip number 6, chew an aspirin. To understand why this is a literal lifesaver, you have to understand what a heart attack actually is. It's not just a clogged pipe. It is an active, aggressive construction site. Most heart attacks occur when a piece of cholesterol plaque in your artery ruptures. When that plaque tears, your body misinterprets it as a bleeding wound. Your blood cells, called platelets, rush to the scene and begin to pile on top of each other to form a clot. The problem is, this clot doesn't just seal a leak, it blocks the entire highway. This is where the humble aspirin becomes a superhero. Aspirin is an antiplatelet agent. It tells those blood cells to stop sticking together. It essentially greases the construction site, preventing the clot from getting any bigger and allowing whatever tiny amount of blood is left to squeeze through to the heart muscle. But here is the detail that saves lives. You must chew it. If you swallow an aspirin whole with a gulp of water, it has to travel down to your stomach, wait to be dissolved, and then eventually pass into your small intestine before it hits your bloodstream. That process can take 15, 20, or even 30 minutes. In an ER, we don't have 30 minutes. When you chew the tablet, you are utilizing the sublingual and buccal pathways, meaning the medicine starts absorbing through the sensitive lining of your mouth and the back of your throat almost instantly. Research published in The Lancet and other major medical journals has shown that chewing an aspirin can get the medication into your system and start thinning the blood in as little as 5 minutes. That 20-minute head start can be the difference between a minor cardiac event and a fatal one. Let's look at the case of Evelyn, a 68-year-old retired schoolteacher from Vermont. Evelyn lived alone with her golden retriever. One morning, while making tea, she felt a squeezing sensation, as if a giant hand were tightening a belt around her ribs. She didn't panic. She called 911, and while on the phone with the dispatcher, she reached into her emergency drawer, grabbed a standard 325 milligram aspirin, and chewed it. When she arrived at my ER, the EKG showed a significant blockage, but her heart enzymes, the markers we use to see how much damage has been done, were remarkably low. Because she chewed that aspirin within minutes of the first symptom, she halted the growth of the clot. She didn't just survive. She kept her heart healthy enough to go back to her morning walks 3 weeks later. A critical warning for seniors. Do not use enteric-coated or safety-coated aspirin if you can avoid it during an emergency. Those coatings are designed to prevent the pill from dissolving in the stomach to protect you from ulcers, which is great for daily use, but terrible for a heart attack. If all you have is coated aspirin, you must chew it even harder to break through that waxy shell. Ideally, you want one full-strength, 325 milligrams non-coated aspirin. If you only have baby aspirin, 81 milligrams, you need to chew 4 of them to reach the therapeutic dose. Of course, if you have a known allergy to aspirin or a history of severe internal bleeding, skip this step. But for the vast majority of people over 60, this is the most powerful medicine you can take before the doctors even see you. It is your first line of defense in a chemical war. But chemistry is only half the battle. How you position your physical body in these moments will determine how hard that struggling heart has to work to keep you conscious. Now that you've activated the emergency system and introduced life-saving chemistry into your bloodstream, we have to talk about the physical mechanics of your body. In the ER, we don't just worry about the heart, we worry about the workload. This brings us to tip number 5. Loosen tight clothing and sit upright. When your heart is under attack, it is essentially a failing engine. If you were driving a car and the engine started smoking, you wouldn't floor the gas pedal. You'd shift into neutral to take the strain off. In a heart attack, your gas pedal is physical exertion and restricted breathing. Most seniors, when hit with sudden chest pain, have a natural instinct to lie down flat on the couch or the bed. It feels like the right thing to do. You're tired, you're weak, and you want to rest. But from a physiological standpoint, lying flat is one of the worst things you can do. Here is why. When you lie flat, your internal organs shift upward toward your diaphragm. This compresses the space your lungs have to expand. Additionally, lying flat increases venous return, meaning more blood flows back to the heart all at once, forcing the struggling, oxygen-starved muscle to pump even harder to move that volume. This can lead to a terrifying condition called pulmonary edema, where fluid begins to back up into the lungs, making you feel like you are drowning from the inside. The solution is the semi-Fowler's position. In the medical world, we use a specific posture to help patients in cardiac distress. You want to sit upright, preferably at a 45-degree angle, with your back supported by a wall or the back of a sturdy chair. Bend your knees slightly. This position uses gravity to pull your organs away from your lungs, allowing for deeper breaths, and it keeps you in a position where, if you were to lose consciousness, you are less likely to choke. While you are getting into this position, you must remove all physical restrictions. Undo your belt. Unbutton your waistband. If you are wearing a tie or a tight collar, loosen it immediately. I have seen patients in the ER who were struggling to breathe not just because of their heart, but because their Sunday best was constricting their jugular veins. Every millimeter of space you give your body is a millimeter of relief for your heart. Think about Margaret, a 74-year-old woman I treated last winter. She was alone when the pressure hit. Instead of lying down on her bed, she sat on the floor, leaned her back against the sofa, and unzipped her heavy winter vest. When the paramedics arrived, they found her calm and breathing steadily. Because she didn't lie down, she prevented fluid from building up in her lungs. Before we move on to the next tip, if you're finding this information valuable, go ahead and tap that like button and make sure to subscribe and turn on the bell icon so you never miss out on powerful health tips like these. It truly helps get this life-saving information to more seniors who might be at risk. This adjustment buys you precious stability. But what happens if the stability starts to fade? What if the room starts to spin and you feel like the lights are going out before the ambulance arrives? That is where we move into the most misunderstood yet fascinating tool in the solitary survival kit. As we move deeper into this survival roadmap, we encounter a technique that is often debated in medical circles, but has a very specific, narrow, and life-saving application for those who are completely alone. This is tip number 4, forceful coughing to maintain consciousness. Now, I want to be extremely precise here. This is not a substitute for CPR if someone else is with you, and it is not a treatment for the heart attack itself. However, when you are alone and you feel the gray out, that terrifying moment where your vision narrows into a tunnel and you feel like you are about to lose consciousness, coughing can become your internal heart pump. The physiological principle behind this is known as cough CPR. When you perform a deep, forceful, sustained cough, the kind that comes from the very bottom of your lungs, you are creating a sudden and massive increase in intrathoracic pressure. This pressure acts as an external squeeze on the heart. In that split second of the cough, the heart is compressed between the lungs and the chest wall, which can manually force blood out of the heart's chambers and up into the brain. For a senior over 60, whose brain is particularly sensitive to drops in blood pressure, these manual beats can be the difference between staying awake to talk to the 911 dispatcher or falling into a dead faint on a locked floor. Studies conducted in cardiac catheterization labs have shown that patients experiencing a sudden arrhythmia, a dangerous rhythm change that often accompanies a heart attack, were able to stay conscious for up to 90 seconds simply by coughing vigorously every 2 to 3 seconds. 90 seconds might not sound like much, but in an emergency, 90 seconds is an eternity. It is the time it takes to crawl to the door, to hit the speakerphone button, or to ensure you are in a safe position before you pass out. Let me tell you about David, a 66-year-old retired mechanic from East Texas. David was in his garage, a good 50 feet from his house, when he felt a sudden void in his chest, followed by a wave of dizziness so strong he felt the floor tilting. He knew he was about to go down. He sat on his workbench, took a huge gulp of air, and began coughing as hard as he could, a deep, chest-shaking cough every few seconds. He managed to keep his vision clear enough to reach his phone and hit the speed dial for emergency services. By the time the paramedics pulled into his driveway, David was still awake and able to tell them exactly where his medical records were. He didn't just survive the heart attack, he survived the blackout that usually leads to a fatal delay. To do this correctly, you must take a very deep breath first. You need air in the lungs to create the pressure, and then cough forcefully and long, as if you are trying to spit out something stuck deep in your throat. You should repeat this every 2 seconds without stopping until you feel the dizziness subside or until help arrives. It is physically exhausting, and that is okay. You are manually doing the work your heart is too tired to do. This technique is your bridge over the abyss of unconsciousness. But once you have secured your consciousness, you must ensure that the help you've called can actually reach you. If you are awake but trapped behind a deadbolt, the best medical team in the world cannot save you in time. We are now approaching the most practical, yet frequently ignored, step in solitary cardiac survival. You have called for help, you have taken your aspirin, you are positioned correctly, and you are fighting to stay conscious. But there is a silent enemy standing between you and the paramedics, your own front door. This brings us to tip number 3. Unlock your door and secure your lifeline. In my 30 years in the ER, I have seen the locked door tragedy play out far too many times. Paramedics arrive on the scene in record time, sometimes in under 6 minutes, but they find themselves staring at a reinforced deadbolt or a security screen. When you are inside having a heart attack, every second they spend using a battering ram or a Halligan tool to break into your home is a second where your heart muscle is dying. Furthermore, the sheer noise and violence of a forced entry can spike your adrenaline, worsening the attack. If you are over 60 and live alone, you must make the unlock a reflexive part of your emergency routine. The moment you hang up with 911, or even while you are on the phone with them, you must move, slowly and carefully, to the nearest entrance and turn that lock. If you have a security system, disarm it. If you have a screen door, unlatch it. You want the path from the ambulance to your body to be as frictionless as possible. Let's talk about Samuel, an 82-year-old widower from a high-rise in Chicago. Samuel felt the telltale elephant on the chest while reading in his armchair. He followed the protocol perfectly. He called 911, he chewed his aspirin, but then he did something brilliant. He realized his apartment had a heavy, fire-rated door that would take minutes to breach. Despite his pain, he crawled to the door, unlocked it, and propped it open with a heavy boot. Then he sat back down and put his phone on speaker. When the paramedics arrived, they walked straight in. There was no shouting, no delay, no broken glass. They were able to start his IV and administer oxygen within 60 seconds of hitting his floor. Samuel's foresight saved his life because he removed the physical friction of the rescue. The second half of this tip is about your phone. Never, ever set your phone down in another room once you've called for help. Keep it in your hand or right next to your thigh. If you collapse, you want that phone to be within inches of your fingers. Many seniors make the mistake of calling 911 and then leaving the phone on the kitchen counter while they go to sit in the living room. If the dispatcher needs to give you instructions, or if the paramedics are lost in your apartment complex and need to call you for a gate code, you must be able to answer without moving. Use the speakerphone function immediately. This keeps your hands free to perform cough CPR or to loosen your clothing, and it allows the dispatcher to hear your breathing patterns, which provides them with vital clinical information to relay to the incoming team. Think of your home not as a fortress, but as a treatment center. You are the head nurse until the doctors arrive. By unlocking that door and clutching that phone, you are clearing the runway for a life-saving landing. You are making it easy for people to save you. Once the door is open and the path is clear, your final job is to manage the internal atmosphere of your body, specifically the air you breathe and the panic that threatens to suffocate you. This leads us into the biological power of controlled respiration. Once the door is unlocked and the path for help is clear, your focus must shift from the external environment back to the internal one. This is tip number 2. Take slow, deep, diaphragmatic breaths. In the chaos of a heart attack, your body's natural instinct is to enter a state of high alert panic. Your heart rate spikes, your blood pressure surges, and your breathing becomes shallow and rapid. This is the fight or flight response, and while it was designed to help our ancestors run away from predators, it is the absolute last thing a failing heart needs. When you breathe rapidly and shallowly, what we call tachypnea, you are actually making your heart work harder while getting less oxygen into your bloodstream. You are revving the engine while the fuel line is clogged. Controlled, deep breathing is your way of manually overriding the nervous system. By forcing your breath to slow down, you send a signal through the vagus nerve directly to the brain, telling it to dampen the surge of adrenaline. This lowers the metabolic demand on your heart muscle. In the ER, we call this reducing myocardial oxygen consumption. If the heart needs less oxygen to function, the blockage in your artery becomes slightly less lethal. The technique is simple but requires immense focus during a crisis. You should inhale deeply through your nose for a count of 4. Feeling your stomach expand rather than your chest. Then, exhale through pursed lips as if you are blowing out a candle or through a straw for a count of 6. This prolonged exhalation creates a back pressure in the lungs that helps keep the small air sacs, alveoli, open longer, allowing more oxygen to pass into the blood. It is essentially a way of self-oxygenating while you wait for the paramedics to bring the actual oxygen tank. Consider the story of Gloria, a 70-year-old retired nurse from Phoenix. When she felt the sudden cold weight in her chest, she knew exactly what was happening. She didn't let the fear paralyze her. She sat in her armchair, dialed 911, and then closed her eyes. She focused entirely on the rhythm of her breath. In through the nose, out through the mouth, she whispered to herself. By the time the ambulance arrived, Her heart rate was significantly lower than most patients in her condition. Her cardiologist later told her that by staying calm and breathing deeply, she likely prevented a lethal arrhythmia, an irregular heartbeat, from triggered by the stress of the attack. This leads us to the final and perhaps most difficult pillar of survival. It is the culmination of everything we have discussed so far. It is the rule that ties the chemistry, the physics, and the psychology of survival together into one singular mandate. Before we reveal the number one tip, the action that research shows can truly double your odds of making it to the hospital alive, I want to remind you that the stories and medical studies I've referenced are all detailed in the description below for your own review. We have reached the pinnacle of the survival roadmap. You have called for help, thinned your blood, positioned your body, secured your consciousness, and opened the way for rescue. Now comes the hardest part of all, the part that goes against every survival instinct screaming in your ears. This is tip number 1. Stay as calm and still as humanly possible. In my 3 decades in the ER, I have seen the difference between life and death boil down to a single decision, the decision to stop moving. When a heart attack strikes, your heart is in a state of metabolic crisis. It is like a runner who has hit the wall, but instead of finishing a race, it is fighting to keep your organs alive with only a fraction of the fuel it needs. Every time you move a muscle, every time you pace the floor, every time you try to tidy up the room before help arrives, every time you even shift your weight aggressively, you are demanding more blood and more oxygen from a pump that simply cannot provide it. The medical science here is absolute. Physical exertion during an active coronary event is like pouring gasoline on a fire. It increases myocardial wall tension, which is a fancy way of saying it stretches the damaged heart muscle to its breaking point. This is when the heart is most likely to short circuit and go into ventricular fibrillation, a state where it just quivers instead of pumping, leading to instant collapse. By remaining perfectly still, you are conserving every drop of oxygen for the heart's own survival. You are putting the heart on life support through your own willpower. Think about Robert, a 71-year-old farmer from Nebraska. Robert was out in his shed when the crushing stone hit his chest. His first instinct was to walk back to the house to tell his wife, but he remembered the rule of stillness. He sat down right where he was, on a cold concrete floor. He didn't move. He didn't even reach for a tool he had dropped. He used his cell phone to call 911, and then he became a statue. He focused on his breathing and his stillness. When the Flight for Life crew arrived, they found him exactly where he had sat down 20 minutes prior, because he didn't try to walk that 100 yards back to the house. He didn't overtax his heart. He arrived at the hospital with heart tissue that was still viable, still able to be saved. Had he walked, he likely would have collapsed halfway across the yard, alone in the dark where no one could find him. This stillness is not just physical, it is mental. I know it is terrifying to be alone when your body feels like it is failing, but panic is a physiological stressor. Panic releases cortisol and adrenaline, which act like a whip on a tired horse, forcing the heart to beat faster and harder. You must talk to yourself. Tell yourself, help is coming. I am doing everything right. My only job is to be still. This mental discipline is your greatest weapon. You are the eye of the storm. We have covered the 7 pillars, but our journey is not over. To truly survive and thrive after 60, you need to understand the aftermath and the warning shadows, the subtle signs that appear days before the attack that most seniors ignore. But before we dive into those advanced survival secrets, I want to hear from you one more time. Where are you watching from today? And do you keep a survival kit with aspirin and your medical history in a place where it's easy to grab? Let's share our setups in the comments to help each other prepare. Your tip could be the one that saves another viewer's life. While the 7 pillars we've discussed are your emergency manual for the moment of crisis, the ultimate survival strategy is to never let the golden window start in the first place. After 30 years in the ER, I have interviewed thousands of heart attack survivors, and a startling pattern emerged. Almost 70% of them admitted that they didn't just wake up with a heart attack. They had shadows of the event, days or even weeks before the collapse. These are what we call prodromal symptoms or soft signs. In seniors over 60, these signs are often dismissed as just getting older, but recognizing them is like reading the smoke before the fire breaks out. The most common soft sign is unexplained, profound fatigue. I'm not talking about feeling tired after a long day of gardening. I'm talking about a heaviness in your limbs that makes it feel like you're walking through deep water just to get to the mailbox. This happens because the heart is already struggling to pump blood through a narrowing artery, and it begins to borrow energy from the rest of your body to keep the core functioning. If you find yourself needing a 3-hour nap after doing something as simple as folding laundry, your heart might be sending you a warning telegram. Another shadow is what we call atypical pain. For many seniors, especially women and those with diabetes, a heart attack doesn't always feel like a crushing weight in the center of the chest. Instead, it manifests as a persistent ache in the jaw, a tingling in the upper back between the shoulder blades, or even a burning sensation in the upper abdomen that feels exactly like acid reflux. I've seen patients treat heartburn with antacids for 3 days, only to realize too late that the burn was actually a slow-moving blockage in their right coronary artery. Consider Eleanor, a 73-year-old grandmother who loved her morning walks. For 2 weeks, she noticed that every time she reached the end of her block, she got a strange, dull ache in her left ear and jaw. She thought it was a toothache, or maybe the cold air. She'd stop, the ache would go away, and she'd continue. What Eleanor was experiencing was angina, the heart's cry for oxygen, because she listened to that shadow and went to her cardiologist before the total blockage occurred. They found a 95% obstruction. She had a simple procedure on a Tuesday and was back to her walks by Friday. She never had to call 911 because she recognized the warning shadow. You also need to watch for sleep disturbances. If you suddenly find yourself waking up in the middle of the night gasping for air, or if you feel like you need to prop yourself up with 3 or 4 pillows just to breathe comfortably, your heart may be struggling with fluid buildup. This is a red flag that your pump is falling behind on its workload. I want you to become an expert on your own baseline. Know what your normal energy level is. Know what your normal breathing feels like. If anything changes, if you feel a weirdness in your chest that you can't quite explain, or a sudden bout of anxiety that feels like a sense of impending doom, do not ignore it. Your body has an ancient, biological early warning system. It knows a crisis is coming before your conscious mind does. Listening to these shadows is how you stay a survivalist rather than becoming a patient. But even if you recognize the signs and follow the pillars, there is one more crucial element to solitary survival: the post-attack blueprint. What happens in the hours after you leave the hospital is just as critical as what happens in the ER. Surviving the initial golden window is a monumental victory, But for a senior over 60, the weeks following a heart attack are a critical period of recalibration. In the ER, we fix the immediate crisis. We open the artery. We stabilize the rhythm. But the real healing happens at home. The post-attack blueprint is about ensuring that the survival you fought so hard for becomes a long-term reality, not just a temporary reprieve. The first thing you must understand is that your heart is now in a state of stunning. Even if we restored blood flow quickly, the muscle cells are bruised and sensitive. This is why the most dangerous time for a second cardiac event is within the first 30 days after the first one. Your blueprint starts with a radical commitment to cardiac rehabilitation. Many seniors make the mistake of thinking that once the stent is in or the bypass is done, they are cured. But a procedure is just a mechanical fix. Rehabilitation is the biological fix. Research consistently shows that seniors who participate in a structured cardiac rehab program have a 25% to 30% lower risk of a fatal second heart attack. These programs teach you how to exercise safely without overtaxing that sensitive muscle, how to monitor your own blood pressure with precision, and how to spot the shadows of a recurring issue before they become a crisis. If your doctor suggests rehab, treat it like a lifeline, because it is. Let's look at the story of Henry, a 69-year-old retired architect from Seattle. Henry survived a massive blockage in his left anterior descending artery, what we often call the widowmaker. He followed the 7 pillars perfectly when he was alone, which got him to the hospital alive. But after he was discharged, Henry struggled with the psychological aftermath. He was afraid to walk to his mailbox for fear of straining his heart. He became sedentary, which ironically made his heart weaker. It wasn't until Henry followed the post-attack blueprint and joined a local support and exercise group that he regained his confidence. He learned that his heart wasn't a broken glass, it was a recovering muscle. By following a graduated walking plan and adjusting his nutrition to reduce the systemic inflammation that caused his first clot, Henry actually ended up in better shape at age 71 than he was at 65. He didn't just survive, he evolved. The second part of the blueprint is medication mastery. After a heart attack, you will likely be prescribed a cocktail of life-saving drugs. Beta blockers to slow the heart and reduce its workload, statins to stabilize existing plaque so it doesn't rupture again, and antiplatelet therapy, like the aspirin we discussed, to keep the blood slippery. For a senior living alone, managing these can be overwhelming. I've seen patients return to the ER because they missed 3 days of their beta blockers and their heart rhythm went haywire. You must use a high-visibility pill organizer, set alarms on your phone, and keep a written daily heart log. Finally, you must address the silent stressor, depression. It is incredibly common for seniors to feel a profound sense of cardiac blues after an attack. Living alone can amplify the fear that it will happen again and I won't be as lucky next time. This chronic stress raises your cortisol levels, which constricts your arteries. Part of your blueprint must include staying socially connected, whether it's through online communities, church, or local clubs. Do not isolate yourself. A heart that is connected to a community is a heart that has a reason to keep beating strong. Now that we've discussed how to live after the event, we need to talk about the emergency environment. How do you set up your home today so that if you ever have to use the 7 pillars, the environment works with you instead of against you? Preparation is the silent partner of survival. If you are over 60 and living alone, your home should not just be a place of comfort. It must be a tactical environment designed to support you during those 7 critical minutes. In the ER, we call this optimizing the field. When we arrive at a scene that is set up for success, our save rate skyrockets. You have the power to transform your living space into a high-functioning survival pod long before an emergency ever occurs. The first step in setting up your emergency environment is the Reach Zone Audit. Think about where you spend 90% of your time, your favorite armchair, your bed, and perhaps your kitchen table. In each of these locations, you need a survival stash. This isn't a complex medical bag. It's a simple, small container, perhaps a magnetized box on the side of the fridge, or a dedicated spot in your nightstand. It should contain exactly 3 things: a bottle of non-coded 325 milligram aspirin, a list of your current medications and allergies, and a card with your ICE, in case of emergency, contact numbers. I have seen paramedics lose 5 minutes just trying to find a patient's list of medications. If that list is taped to your refrigerator or sitting in your reach zone, those 5 minutes go back into saving your heart. Next, we must talk about the communication web. If you live alone, a cell phone is not a luxury. It is a medical device. You must ensure that you have charging anchors in every room. Never let your phone drop below 50% battery. More importantly, you should enable emergency SOS features on your smartphone. On most modern phones, pressing the side button 5 times rapidly will automatically call emergency services and send your GPS coordinates to your designated contacts. For a senior who might be too weak or too dizzy to dial a keypad, this one-handed gesture is a literal lifeline. Practice this move today while the phone is locked, so your muscles remember what to do when your brain is in a fog of pain. The third pillar of your home setup is the physical clearance. Look at the path from your front door to your primary seating area. Is it cluttered with throw rugs that can slip? Are there tight corners that a paramedic stretcher cannot navigate? In the ER, we often hear stories of the second trauma, where a patient having a heart attack tries to reach the door, but trips over a loose rug or a coffee table, causing a head injury that complicates the entire rescue. Clear your rescue runways. Ensure your house number is clearly visible from the street and well lit at night. If the ambulance has to hunt for your address, your golden window is shrinking with every pass they make around the block. Finally, consider the medical ID strategy. I am a huge advocate for digital medical IDs that can be accessed from a phone's lock screen, but I am an even bigger fan of the vial of life. This is a simple medical form placed inside a pill bottle and kept in the door of your refrigerator. Paramedics are trained to look for a specific sticker on your front door or fridge that alerts them to this vial. It tells them your history even if you are unconscious. By setting up your home this way, you are removing the variables. You are taking luck out of the equation and replacing it with design. You are ensuring that if the moment comes where you must sit still and breathe, the environment around you is doing the work so you don't have to. You are creating a fortress of survival. Now, as we prepare for the final phase of this journey, we are going to tie everything together. We are going to look at the ultimate survival checklist, a condensed, powerful summary you can print out or memorize, and I will leave you with a final message from the heart of the ER. But before we finish, remember, knowledge without action is just information. Action is what keeps you alive. We have traveled a long road together, from the frantic seconds of the first chest pain to the meticulous preparation of your home. You now possess more life-saving knowledge than 95% of the population. But in the ER, we know that knowledge under pressure can evaporate if it isn't anchored by a clear, simple plan. This final phase is your emergency manifesto, the condensed sequence of actions that will bridge the gap between a medical catastrophe and a story of survival. If the moment ever comes where you feel that unmistakable pressure, that sudden wrongness in your chest, or that cold phantom sweat, I want you to stop thinking and start executing this survival checklist. Activate. Dial 911 immediately. Say the words, "I am over 60, I am alone, and I believe I am having a heart attack." Chemistry. Grab your non-coated aspirin and chew it thoroughly. Let it enter your bloodstream through your mouth. Posture. Find your semi-Fowler's spot. Sit upright at a 45-degree angle with your back supported. Do not lie flat. Relax. Loosen your belt, your collar, and any restrictive clothing. Give your heart and lungs room to expand. Access. Unlock your front door. Clear the path for the people coming to save you. Oxygenate. Focus on your breath. In through the nose for 4, out through pursed lips for 6. Stillness. Stop moving. Become a statue of calm. Conserve every ounce of energy for your heart muscle. I want you to take a moment and look at the people in your life, your children, your grandchildren, your friends, and your neighbors. You aren't just surviving for yourself. You are surviving for them. A heart attack is a lonely experience in the moment, but the aftermath involves everyone who loves you. By following these steps, you are giving them the gift of more time with you. You are ensuring that you remain the patriarch or matriarch of your family for years to come. I've seen the golden window open, and I've seen it close. I have held the hands of those who made it and those who didn't. The difference is almost always found in the first 10 minutes of the attack. You now have the map. You have the tools. You have the power. Before we part ways today, I have one final request. This information is a heavy burden to carry alone. I want you to share this video with at least one person you care about, whether it's a sibling, a friend at the community center, or a neighbor who lives alone. Send them this link. You might be the reason their golden window stays open. And finally, if you haven't already, please like this video and subscribe. We are on a mission to turn the vulnerable into the prepared, and your support is the heartbeat of this channel. I personally read every comment, so if you have a question about anything we discussed, from the aspirin dose to the breathing techniques, drop it below. I will be there to answer. Thank you for your time, your focus, and your commitment to your own survival. Remember, you are not a victim of your biology. You are a survivalist. Stay safe, stay prepared, and I'll see you in the next masterclass. This is the ER Perspective, signing off.